We're discussing a case involving an 80-year-old gentleman who's been living in a nursing home. He is known to have a medical history of dementia, which has been managed at the care home, along with hypertension. Over the past 2 days, there has been a significant change in his condition. His carer observed a marked increase in his levels of confusion and agitation. This shift in behavior was concerning and diverged from the patient's usual demeanor. These symptoms were new and presented a contrast to his usual state of health. Given this rapid and somewhat alarming change in mental status, the decision was made to bring him to the hospital. The main focus now is to identify the underlying cause of this acute onset of increased confusion and agitation and manage it effectively to restore the patient's health. The objectives moving forward will be to conduct a comprehensive assessment of the patient, taking into account his current symptoms, past medical history, and potential triggers for this abrupt change. Our goal is to provide the most accurate diagnosis and subsequently, the most effective treatment plan for this gentleman. The patient, an 80-year-old male, has a medical history that is notably significant for dementia. He has been living in a nursing home where his dementia has been managed through both pharmacological interventions, with a stable regimen of medication, and comprehensive care provisions offered by the facility. His routine at the nursing home had been uneventful, with the patient generally in a stable state, keeping in line with the expected progression of dementia. However, a sudden change in his mental status was observed approximately 2 days ago. His caregiver noted an increase in his usual level of confusion, which was coupled with an unusual state of agitation. These behavioral changes were out of the ordinary and caused concern as they represented a departure from his usual demeanor. Despite these changes, there were no recent adjustments to his medication regimen that could explain the sudden shift in behavior, thereby eliminating potential pharmacological causes. Similarly, he did not exhibit any signs of common infections, such as fever, which could also potentially lead to altered mental states. In addition, there had been no recent physical traumas such as falls or other injuries that could have potentially contributed to his increased confusion and agitation. The patient also did not display urinary incontinence or frequency, often associated with urinary tract infections, which can lead to confusion in the elderly. Thus, this sudden change in the patient's mental state is not readily explained by his known medical history, recent medication changes, or common physical symptoms associated with confusion and agitation in the elderly, making the situation a complex one necessitating a thorough evaluation to establish the cause of the change. Upon conducting a physical examination of the patient, it was found that his mental state had indeed altered. His sense of orientation was compromised. He appeared disoriented, unable to correctly identify the time or place. This kind of disorientation could be indicative of an acute confusional state or a possible exacerbation of his known dementia. Interestingly, the examination didn't reveal any signs of recent trauma. This is crucial because trauma, especially in geriatric patients, can sometimes trigger changes in mental status. However, the absence of any external signs of injury or distress ruled out trauma as a cause of his sudden change in behavior. In terms of his vital signs, temperature, pulse, respiratory rate, and blood pressure all were found to be within normal limits. This is significant as changes in vital signs can sometimes be indicative of systemic illnesses or infections which can lead to delirium, especially in older adults. A thorough neurological examination was also conducted to assess his brain function. This involved testing his reflexes, strength, balance, coordination, and sensory function. Impressively, he didn't present any focal neurological deficits. In simpler terms, his brain seemed to be functioning normally without showing signs of conditions like stroke, which is often a concern in patients with acute changes in mental status. Overall, the examination findings have steered the differential diagnosis away from conditions such as trauma or stroke, making it necessary to delve deeper into other possible causes of the patient's heightened confusion and agitation. In order to understand the cause of the patient's increased confusion and agitation, a series of diagnostic investigations were initiated. The primary goal was to determine whether the sudden change in mental status was due to an acute medical condition or an exacerbation of his existing dementia. The laboratory workup included a complete blood count, CBC, renal function tests, liver function tests, and an electrolyte panel. The CBC was performed to detect any signs of infection or anemia, which could contribute to cognitive changes in older patients. Renal and liver function tests were done to evaluate the patient's overall metabolic status and identify any potential organ dysfunction that could be contributing to his symptoms. An electrolyte panel was performed to detect any imbalances, such as high or low levels of sodium or potassium, which could affect brain function and mental status. Additionally, a urine analysis was ordered to rule out a urinary tract infection, a common cause of confusion and changes in mental state in geriatric patients. Brain imaging was also considered as part of the diagnostic process. This would help in ruling out acute intracranial processes, such as a stroke or hemorrhage, that could be causing the sudden onset of symptoms. By systematically ruling out potential causes, the healthcare team hoped to identify the underlying reason for the patient's increased confusion and agitation. In this clinical scenario, our patient, an 80-year-old man, presented with a sudden change in his mental state characterized by increased confusion and agitation. The clinical reasoning behind this case was guided by a thorough consideration of the potential differential diagnoses. Given his age and presenting symptoms, a few likely conditions come to mind. One of the common causes of sudden confusion in the elderly is a urinary tract infection, UTI. Although UTIs typically present with symptoms related to the urinary system, in older patients, they can atypically manifest as changes in mental status without classic urinary symptoms. Another potential cause could be an electrolyte imbalance. Imbalances in certain electrolytes, such as sodium and potassium, can affect the functioning of the brain and manifest as confusion or altered mental state. The patient's existing diagnosis of dementia might also be a factor. It was necessary to consider whether this might be a case of a sudden progression or exacerbation of his underlying condition. A stroke was another possibility. In older patients, cognitive changes can sometimes be a sign of a cerebrovascular event. However, the patient's normal vital signs and the absence of neurological deficits made stroke less likely in this instance. Despite stroke being considered less likely, it was essential not to rule it out immediately without further investigation. The serious nature of strokes and the potential for severe outcomes if left untreated necessitated its inclusion in the differential diagnosis until definitive tests could be conducted. The reasoning process in this case was based on the patient's symptoms, age, and medical history. It's an example of how a wide differential diagnosis is necessary when faced with symptoms that could indicate a variety of conditions, particularly in elderly patients where presentations might not be typical. It was essential to use a combination of the patient's clinical presentation, past medical history, and results from investigations to narrow down the potential causes, rule out life-threatening conditions, and guide appropriate management. In the context of the present case, the patient's abrupt change in mental status necessitated a detailed and thorough approach to management and a close watch on his clinical progression. The initial management plan for this elderly patient began with ordering a broad array of lab investigations. The aim here was to determine the cause of the sudden shift in the patient's mental state, considering possibilities like infection, metabolic imbalances, and other common causes of altered mental status in the geriatric population. As the patient was notably agitated, non-pharmacological methods were employed to alleviate his discomfort. This often involves using calming techniques like reassurance, maintaining a quiet environment, and minimizing disruptions to the patient's routine as much as possible. The objective here is to provide comfort and reduce stress, which can help mitigate symptoms of confusion and agitation. Upon receiving the lab results, it was discovered that the patient had a urinary tract infection. This is a common condition in the elderly population and can lead to an altered mental state. It is a frequent cause of confusion and delirium in older adults, especially those living in long-term care facilities like nursing homes. Once the diagnosis was established, the patient was promptly started on a course of appropriate antibiotics to address the urinary tract infection. The choice of antibiotic would be guided by local guidelines and susceptibilities, taking into consideration the patient's overall health status and potential for drug interactions given his age. the management plan, centered on treating the identified urinary tract infection, proved successful. Over the subsequent days, a significant improvement was noted in the patient's state. The confusion and agitation that had initially brought him to the hospital noticeably subsided. This positive outcome emphasizes the importance of thorough investigation, accurate diagnosis, and appropriate management in healthcare, particularly when dealing with vulnerable populations like the elderly. In this particular case, we were faced with an elderly patient whose primary symptoms were increased confusion and agitation. These are common symptoms in geriatric patients with various underlying conditions, and their cause can sometimes be elusive. This patient, however, provided a lesson in the necessity of considering common, treatable conditions that can often present atypically in this patient population. In geriatric care, it's crucial to remember that signs of common illnesses may not appear as we typically expect them to. In our patient scenario, a urinary tract infection, generally known for symptoms such as pain, frequent urination, and potentially fever, manifested itself through increased confusion and agitation. These symptoms could have easily been attributed to the progression of his dementia. However, we learned that these changes in mental status could also be signs of an underlying, treatable condition. By considering the possibility of a urinary tract infection and acting promptly, we were able to treat the root cause of the patient's increased confusion and agitation successfully. This had a significant positive impact on the patient's condition and quality of life. The case emphasizes the importance of maintaining a broad differential diagnosis and considering common conditions that can present atypically, particularly in geriatric patients. The prompt recognition and treatment of the urinary tract infection led to an optimal outcome for the patient, reinforcing the vital role of early diagnosis and intervention in healthcare. In evidence-based medicine, we refer to a body of research, guidelines, and protocols to support our clinical decision-making processes. The case of the 80-year-old male patient from the nursing home who exhibited increased confusion and agitation is an example of this approach in action. The prevailing clinical guidelines stress the significance of identifying and excluding common, reversible causes of delirium in older patients. These include but are not limited to infections, such as urinary tract infections, and metabolic derangements, both of which can exacerbate confusion and agitation in elderly patients. In this particular case, the care team's decision to order a comprehensive set of lab investigations was crucial in recognizing and confirming the urinary tract infection that was the root cause of the patient's increased confusion. This approach is fully in alignment with the current clinical guidelines, demonstrating the importance and effectiveness of evidence-based medicine in the management of patient care. By adhering to these guidelines, the care team could promptly initiate appropriate treatment for the patient. This led to a noticeable improvement in his condition over the subsequent days, underscoring the power and value of evidence-based practices in enhancing patient outcomes. The case of the 80-year-old man from a nursing home who presented with increased confusion and agitation serves as an important learning opportunity for healthcare professionals dealing with geriatric patients. This scenario underscores the significance of maintaining a high degree of suspicion for common, potentially reversible conditions, such as urinary tract infections, which may present atypically in elderly patients, in this case, as sudden cognitive changes rather than traditional symptoms. In this particular situation, the patient's altered mental status, which was a deviation from his usual dementia baseline, required immediate attention and a thorough evaluation. Prompt ordering of comprehensive laboratory tests facilitated the detection of a urinary tract infection, emphasizing the importance of timely investigations in the face of such symptoms. The patient's improved condition following the administration of appropriate antibiotics showcases the impact of early recognition and treatment in the geriatric population, ultimately leading to better patient outcomes. Moreover, this case highlights the essential role of communication in healthcare, especially when dealing with caregivers of elderly patients. Caregivers are typically the first to notice any changes in a patient's condition, making them a valuable source of information. Educating caregivers about the potential complications and atypical presentations of common conditions in the elderly can enhance early detection and intervention, thus improving the overall care for the patient. Going forward, it is crucial to apply the insights from this case to future clinical practice. This involves maintaining vigilance for atypical presentations in elderly patients, ensuring prompt and thorough investigations for altered mental status, and enhancing communication with caregivers for early symptom recognition. In this particular instance, the patient's care team did an outstanding job by responding swiftly and effectively to a significant change in the patient's condition. A quick diagnosis was made possible due to the immediate recognition of symptoms, initiating the necessary investigations, and determining the appropriate treatment for the patient's urinary tract infection. The patient's increased confusion and agitation, key changes from his usual behavior, were promptly picked up by his carer. This highlights the vital role that caregivers play in the care continuum, especially for those caring for vulnerable groups such as the elderly. However, there's always room for growth and improvement in our healthcare delivery. An area to further strengthen in future would be improving communication with caregivers. Caregivers are usually the first to notice subtle changes in patients, and their experiences and observations can provide invaluable insights that might not be otherwise apparent during a standard clinical evaluation. Moreover, it is also crucial to ensure that the caregiver is well informed about the patient's condition, the potential complications, and any changes in treatment plan. Providing clear, comprehensible, and relevant information can aid them in providing better day-to-day care and make informed decisions when needed. Lastly, in striving for the highest quality of care, we must remember to provide comprehensive, patient-centered care. This involves considering each patient's unique circumstances, such as their living conditions, mental status, and personal wishes. By integrating these aspects into our care plans, we can ensure that our patients are not only treated medically but also feel understood, respected, and supported in their healthcare journey.